Many patients suffer with excess skin around the umbilicus, especially after pregnancy or weight loss. And this area is obviously central to the abdomen, and during pregnancy is the area that gets stretched the most. So it's common for patients to complain about this skin excess. Obviously, that skin excess is away from the pubic area, and there are different ways to be able to consider addressing this. The commonest, however, is a standard abdominoplasty to place a scar just above the pubic area and raise the skin up and then remove the excess. Of course, one of the issues is if the patient has significant tightness in the lower abdomen but just excess skin around the umbilicus, then one may consider other operations, which include the excision of that tissue directly with a fleur-de-lis abdominoplasty or a vertical scar. And there are other options to try and bring down the umbilicus or float the umbilicus, or to try and bring the excess skin upwards in the case of a reverse abdominoplasty. This is a lady who has got a lot of excess around her umbilicus. The divarication has split and her muscles have separated. And in this case, the lady has opted for a classic abdominoplasty. The tissue in the lower part of the abdomen is quite tight, but after the scar has been placed just around the pubic area and the skin has been raised, the majority of the excess skin has been excised. However, because of the tightness, she's required a small vertical line at the bottom of the scar, and we can see this lady's long-term post-op result showing the removal of the excess skin around the umbilicus, a tightening of the recti muscles and a closure of that muscle separation. And the small vertical scar, which has been used to aid the closure, is barely noticeable. Often this is the best way to try and address the excess skin around the umbilicus. However, this small vertical line can be higher in certain patients.